Hi, everybody. So welcome to another episode of Conversations on Healing Trauma and Finding God. And today I'm very, very excited to have a friend of mine. I'm going to be talking to her, the wonderful Alison Stockton. Alison is a trauma-informed functional medicine practitioner. And we are going to be having a conversation today about the links between healing trauma the links between stress, trauma, and physical illness and disease. Ever since I read the book, When the Body Says No by Dr. Gabor Mate, I have been absolutely fascinated by this topic. And it's something that comes up a lot for me because when I work with clients, especially with EMDR, I see all the time, I see the link between physical symptoms, physical illness, and, stress and trauma. So I'm really excited that we're going to be having this, as I say, this discussion today. So without further ado, I'm going to hand over to my friend Alison. And Alison, please introduce yourself to the viewers.
Oh, thanks, Ali. So, yeah, I'm Alison Stockton. I have had 25 years in wellbeing, working with women specifically. And over the last 6 years, just gone deeper into education from integrative, holistic health coaching, functional medicine, being trauma-informed, emotional intelligence, all of the things and the tools that really help us to become consciously aware of our patterns and behaviors and find the links. And functional medicine specifically is literally detective work to find the root cause of illness and not just see the person with a symptom and say focus on the gut or focus on the kidneys or focus on one body part. It's the interconnectedness of everything. And like you said with Gabor Mate, when the body says no, it's usually manifested even a decade, 2 decades prior to your symptoms becoming really profound. So it's really interesting.
Wow, very, very interesting. So what was it? Because I know you've got loads of qualifications and you started out years ago, very much in sort of fitness and nutrition. And then as time's gone on, you've kind of expanded and moving more into the trauma work, right? So what was it that kind of inspired you or motivated you to kind of expand your training and your area of expertise, so to speak?
I have goosebumps when that for some reason. So, 21, became a personal trainer. I myself had eating disorders, was anorexic, bulimic, all the things, never really connected the traumatic experiences, and it was my behavioral patterns and my coping mechanisms and everything else. Then I would work out and beat myself to the pulp, literally working out as hard as I could. And then, I'd noticed as a personal trainer, you kind of develop coaching skills without being a coach. I'm talking 25 years ago when this began. And you start talking to clients, and, especially if they had weight gain, and it would be a traumatic experience when they were 10 years old. It could have been a parental divorce. It could have been they didn't connect with their parents. It could have been abuse that was never really spoken about. It could be a hyperachiever, overachiever that would just come into the gym and that's, they wanted to work out as hard as possible and push as hard as possible. But actually, if I knew then what I know now, we could actually really see the links of interconnectedness and understand why sometimes they don't reach their desired goals. But over that period of time, I had a few issues going into more trauma, so complex trauma myself in my lifetime. And then I started to develop panic attacks, anxiety. There was a separation from my ex-partner, issues with the children. And these panic attacks and anxiety they were debilitating, that they had actually caused the I can never say it right now when I'm on the spot. Vasovagal syncope, or vago, however you want to say it. So basically what happens is for me, it was 2 corresponding elements. I would have clinical deja vu, where I would feel that I was in a dream and something was happening, but I wasn't present. It was like almost an outer body experience that was happening at the time. And then what would happen is I would lose consciousness. and then find myself, deep in breath, or the panic attacks would happen, and I would have, not going woo-woo here, but I would have a sensory of the woman who was causing me so much anxiety would be present. And I'd start having the physical feelings, because anxiety and panic attacks are a physical feeling, an emotion from your thoughts, as you know. And then I would turn around and that person would be there.
Wow.
What had happened on this particular occasion was we'd gone through the separation. I'd had to move away from my children. I never spoke about this scenario that was going on in my body. I never spoke about these kind of feelings that in my mind, where I would feel that I was just out of body. And then I wouldn't tell anyone that I'd actually passed out and was on my knees on a pavement, or so on and so forth, until it happened in a car. And I remember being at the traffic lights and not knowing how long I'd been there for.
Oh my goodness. Right.
It had gone to the point where maybe just a thought had stimulated it. There wasn't necessarily a panic or an anxious situation, but it wasn't the last time it happened, but the most severe time was I was driving. We lived in the UAE, if people know the crazy roads of Dubai, and I was on the highway, and I don't know what speed I was doing, but I lost consciousness. I'd gone into this scenario, and again, I never knew whether it was real or whether it would just pass, whether it was a dizzy feeling or whatever. And the next thing you know, I'm being pulled out of a car because I've literally smashed my car into 10 other cars in a concrete bollard. And thankfully, I was pulled out with injuries and what have you. But it was at that moment, for 2 weeks, I had a pity party and wished that, because when you have depression, anxiety, panic attacks, all these things, sometimes you just feel that you're not going to get through it. And I didn't have the trauma-informed understanding that I have now. I didn't have you to kind of reach out to and say, people like you that do the amazing work that you do. I didn't have that. So my hyperachiever and my just get on with it. Just get on with it. What have you got to be, traumatized about? What have you got to be anything about? Just get on with it. So pity party for 2 weeks. And then I just had this epiphany that I wanted to be and create more for women, so that vasovagal syncope might not be their thing, but anxiety, depression, emotional eating, all of these things, just the constant do, go, trying to hide and suppress what's really truly going on, to not fully live their lives. That was when I decided that that's what I was going to do. So it's probably longer now in this journey. So the accident was 2015. Then I started integrative health coaching 2017, because we left Dubai. So qualified in that in 2018. And then it's just gone on and on and on, and learning more about, the human body. And Bessel van der Kolk, you've just mentioned Gabor, but the body keeps the score. And literally score. So on top of that, from me personally, and again, for anyone who's watching and listening right now, other things had already started to happen: fibromyalgia, hypothyroidism, I had eczema as a kid, which I didn't associate anything to. I just thought it was an infection in my ankle and didn't put anything to it. And the dizziness, constant dizziness, which I just thought was part of me. And actually, when you have signs of dizziness and those symptoms, that's your adrenals not functioning properly because of the stressors that you have undertaken. Joint pains, issues, those type of things. And I know you've got questions, so I'll pause on there, but I know that to be true when those things happen, because it happened to my mum. So having hypothyroidism and being diagnosed with Hashimoto's, I'd lived my life quite long before that, not having it and feeling relatively okay. But the trauma response from my mum when her mother died, she physically lost her voice and couldn't speak for 2 weeks.
Wow.
And anytime now she is in stress or has an emotion flashback to a traumatic event, because that's just one traumatic event, there was many others again, but again, born post-war, pre-war, just get on with it. Just get on with it. Work harder, forget about it, don't deal with it. Then, over the years, I watched my mum in constant pain and struggle with undiagnosed illnesses. And so all she was told to do was just, you're tired again? Come on, get on with it. What's the matter with you? You know, not never, and again, this is a Gabor thing. It's not what happened to you. What's wrong with you?
Yeah, absolutely.
Well, this is wrong with me because of this is what happened to me. Anyway, that's that. I know you have lots of questions. So that was my intro into why I decided to start this journey and just draw the dots and connect to, you know, what's truly going on and how we can go on we can either be on a persistent do journey and just live our lives, almost disconnected and dissociated from self, or we can take the opportunity to think, actually, I'm ready for more. And I want to be able to go on a healing journey as opposed to a survival journey. We're humans, we're meant to survive. That's the whole purpose of us being here. But, you know, we can go into the point where we want to actually start to thrive and really enjoy our lives rather than being hypervigilant, like I was, that panic attack. They're here. I can feel them. I know that they're somewhere close. You know, it's taking back your power.
Isn't it funny how we still very much as a society, we're still very much in that mindset of, oh, just push through, just, you know, get on with it. I think especially in the UK, I find my US clients are sort of have a different perspective on all of this, right? But I still think we've got such a long way to go. You know, there's more research coming out all the time to show that you know, more books being written to show the link between physical illness and stress and trauma, but yet we still have a way to go, I think, in my opinion. So that's a fascinating story. Yeah, absolutely. That's
so much more amazing now than it was 20 years ago. But imagine what it's going to be like in 20 years from now with all the research and things. You know, I'm through psychology, you read back and they would do the proscopy. I can't say the word properly. I've got to default with my brain today talking about it. When they dissect the brain, the words got out of my brain actually as I needed. And they would take out things like the hippocampus, or they take out the amygdala and see how they would function, because they thought if they took out different things, they would be fixed. Where actually it's a chemical thing, unless you've got obviously something far more serious as a brain tumor or brain cancer. But the psychiatrists and the psychologists, and even, you know, cognitive behavioral therapy or whatever, which is now being proven not to be as beneficial for many, but it can't just be a medication by itself. It needs to be something else. The medication has advanced massively, and albeit functional medicine, we look at how we can have a holistic approach without taking pharmaceuticals, but sometimes it's a short-term process for a long-term gain. So if we take the medication, and I'm not a doctor, I can't prescribe, along with alternative holistic therapies in a healing journey, that person is far more likely to heal and to feel connected to themselves, to feel that they're empowered by themselves, rather than just having an antidepressant with no other holistic, like changing your diet, moving, those type of things. Here's the prescription, off you go. Come back in 3 months, let me know if things have changed.
Yeah. And that's very much the way that the way that Western medicine, you know, the methodology that they adopt is very much cure rather than prevention, right?
Because the studies have been done where it's, you know, the placebo effect. So you give a group or who have, I mean, it could be post-war veterans. I can't reference off the top of my head immediately who these references were, but you can go onto PubMed or any of those kind of scientific researchers, and you will see, like I said, it could be a war veteran, it could be somebody from any traumatic experience as a group, and you have separation of one has the medication, one has the placebo, and then you see how they are progressing in their growth mindset and releasing that those depressive thoughts and those depressive feelings.
Sure. Yeah.
Yes.
So, Alison, could you define what functional medicine is? I know you're a trauma-informed functional medicine practitioner, so I think there may be some viewers who don't actually know what that is. Could you explain in simple terms?
doctors don't really understand what functional medicine is anymore, but we're kind of going back to the roots. Literally, we're going back to how things used to be in medicine hundreds and hundreds and hundreds of years ago. Why is this person coming to, it might be for a tincture or a herbalist or something. Well, what happened? Where were you? What was the situation? What was the scenario? Herbalists have been around for hundreds and hundreds of years before, thousands of years, millions of years actually, before Western medicine came in. So functional medicine literally gets to detective work to find out what is the root cause. We have symptomology, which is what you go to the doctor with, and then you have a prescription. Functional medicine, we take a look at you as a whole being, your brain, your body, your soul, your story, and what happened to you, and we look at the timeline and we intersect what has happened over periods of time. I was 7 years old. I was pinned down at the dentist. I now have a traumatic response, but now I have mouth issues. I have gum disease. I have all of these things, so on and so forth. It could be an appendix, for example. A child has been pinned down. Anything that was a traumatic event to that person. They have gastrointestinal issues as well. So the functional medicine aspect of it is we look at that person as a whole being, listen to the story, because the story matters, give them time, give them presence, and then go into detective work. I mean, when you see my wall when I'm working with a client, it is like something out of a movie, because I've got all these pieces of paper, because that's how I'm very tactile. I like to look at it. So it's like, okay, migraines keep reoccurring. It could be anxiety, as we've spoken about before. It could be that there's issues with menstrual cycles. It could be fibroids. It could be hormone imbalances, not just sex hormones. It could be hormones of insulin or anything that's happening. You know, they have insulin resistance. So thyroid issues. Whereas again, a doctor will just say, okay, you're a bit tired. You're probably menopausal. Well, actually, no, I'm 35. I've got dry skin. My eyebrows are thinning. I don't feel myself. And they're like, okay, take HRT. Well, actually, let's test the thyroids first. So we would do that. So functional medicine is basically looking at you and listening to what's going on. So if you are at a state of imbalance right now, and that is dis-ease, so the state of dis and ease in the body, can we prevent it moving into disease? Can we prevent, or can we work with your chronic illness now? So it could be the trauma has affected insulin and blood sugar, as I just said, because even a traumatic event and chronic stress creates acidity in the body. That over it, and we're meant to get stressed. We're meant to, you know, it takes us to hormesis. But if we don't have a state of balance and coming back from that, what's that book that when the zebra?
So completing the stress cycle, right? As Peter Levine talks about
that's it. The zebra goes off, the zebra shakes, the zebra's just been attacked by a lion. Lion didn't catch the zebra. Zebra runs off. Oh, happy days, and back to normal life. Let's forget about that. But for a human, we can either ruminate that in our brain, which then creates dis-ease in the body, because we're not at ease. We're at a state of dis-ease, not yet disease or chronic illness. But we're ruminating over that. We're dreaming about that. We're waking up about that. We're reliving that again the next day. We're going to work and our boss is an absolute idiot, unless you work for yourself, which you might even feel the same. But that cycle repeats. So we then have this imbalance in our body all by itself from one event, or maybe reoccurring.
So when you talk about that dis-ease, then essentially what you're talking about is that survival response. So living from that place of survival, which essentially is fight flight, which a lot of people are in without even realizing it, because people learn to mask it and use coping mechanisms like alcohol and sugar and all of that to mask the symptoms. But is that what you mean when you talk about disease being that fight flight response?
Yeah, not necessarily that. It could be that hypervigilant as well, or it could be the fawn. Even that response takes us into, okay, fawn, don't see me. Nobody can see me. I'm going to hide. I don't want to be myself. I'm not really who I am meant to be. If I just do this, I can protect myself. So
but you still dysregulated in your nervous system when you in fawn, right?
regulation. That itself creates a state of dis-ease in the body. If the nervous system is dysregulated, we can't absorb nutrients the same way. We then have a state of microbiome imbalance, which is we have microbiome all over us and all within us. We're actually more cells and microbiome than we are human DNA. And if that is, so for example, you've gone through a traumatic response, we might pee ourselves, for example. That's the body like, let's release and let's go. You may have diarrhea, or you may be constipated. So that one reaction for that, again, day after day after day after day, it's normal for me not to go to the toilet for 5 days. Okay, that's creating oxidative stress in your body by itself. That is not allowing your body to absorb nutrients. That is creating toxicity overload where you can't metabolize and work on the detox pathways. That said, if somebody is constantly urinating, they have triggered the adrenal response to be in a stress state. If somebody has diarrhea because the stomach is gurgitating all the time, they are equally malnourished because not utilizing the nutrients that they've put in. So the gut is distressed. And if the gut is distressed from that one event, 2 events, daily events, whatever, and again, you mentioned alcohol, sugar, so on and so forth, that's my coping mechanism. But actually, it's adding fuel to that already fiery, inflamed body, which dysregulates the microbiome. So the microbiome migrate to somewhere where it's not meant to be. We disrupt the blood-brain barrier. We disrupt the vagus nerve and the vagal tone. So all by itself, that functional medicine approach is not just, well, dysregulated and hypervigilant and stressy. Calm down. Why don't you calm down? Is like fuel to the fire.
Yeah. Or just go and do some yoga, or go do yeah.
But yoga's great because yoga, when you're in the breath state and present state with your body, that's great. But if it's like, I've got to be the champion yoga person, I've got to be, that's causing that distress again. So functional medicine is all about, let me listen to everything that's going on with you. Let me listen to how many times a week, month, year you have migraines. Migraines are not normal, but what they are. And when you said the state of dis-ease, it's like I run a program called Your Inner Wisdom, and it's about the body whispering to you constantly, and the body will always whisper. If you have a headache in functional medicine, we look at that as a blessing because it's your body signaling that something isn't functioning optimally. So let's figure out why. Is it through the spinal cord? Is there something structurally not at balance? Because again, your body can alter with stress because you hold yourself differently. You know, we hold ourselves tense. It can create kyphosis in the upper body. It could create scoliosis because of the way you are. So the structure changes. Is that what's caused the headache? Is it a magnesium deficiency? Is it the fact that you've constantly got diarrhea, that you're not holding on to anything? Is it the fact that you're always constipated, that you're so toxic, your brain, the blood-brain barrier is not working properly? Is it that you've become so dysregulated in all of your body systems that you actually absorb toxins from all over the place, and that in itself triggers a headache? We can go on about this, you know, EMFs and electrical magnetic frequencies affect people now. Mold toxicity. If you mold, if you have heavy metals, all of these things are dysregulating your human state of balance, which is dis-ease, and in a continuing process creates disease and chronic.
Oh my goodness, it's fascinating. You said something, I'm just going to backtrack a bit, because you said something about stress puts our body into a state of acidity. Was that right? Could you just explain it to the viewers?
I'll try and explain it as simply as possible. So if you don't have, we need stomach acid. We need stomach acid to digest our food, to function optimally and what have you. And then there is a level that we need alkalinity. So the alkaline way that people think can take it too alkaline, that there's not enough acidity to then, you know, let me use the right word here, to balance out the bacteria that might be in the wrong place, for example. When people belch and people, you know, a lot of people who have stress and chronic stress and trauma have an acid reflux. And most people think, oh, I need to lower my pH. I need to actually know it means that there's not enough acid in your stomach to digest the food that you're putting in. So you actually require to have stomach acid for order to do that. So we can do tests like you can take bicarbonate soda to see how acidic you are and how alkaline you are. You just take a teaspoon of bicarb soda in some warm water and see how long it takes for you to belch. And you will know. It's like, you know, in all parts of our body, even in our vagina, we need to have a certain amount of acidity, because if we're too alkaline, we start to create fungal infections. And again, that is something that I've noticed with a lot of clients who've had traumatic experiences, that they get candida overgrowths because it's just too alkaline. Oh, on happy days for the bacteria, I like to just grow here. So there is a state of having alkalining foods, alkalining beverages, but also having acidic foods and acidic beverages as well, so that we can create a balance. So acidic like lemons, oranges, pineapples, you know, and then having more balanced foods like good fats and proteins. Proteins, again, if you haven't got enough stomach acid, you can have trouble to digest it. So it's about having a state, and everybody is different. So I'm broad blanketing that. But everybody's different at their state. So if they've taken a PPI, proton pump inhibitor, which is for acid reflux, they require more stomach acid.
Right.
Because otherwise it goes into something called GERD and esophagitis, and it's creating a burning in the esophagus as they swallow foods, and then it's just coming back up. That again could be the liver or the gallbladder and the bile. Because again, a lot of my clients who come that have had trauma, the liver isn't optimizing in a healthy state. Therefore, the bile isn't working. And then that affects how many hormones are transported through their body. So when they have hormonal imbalance or headaches or, you know, thyroid issues, sex drive, all of these things, that bile is required in order to keep everything flowing, excuse me.
Wow, fascinating. What is meant by the term adrenal fatigue? Because I know this is something that's, again, it's a term that you hear a lot of, and I know that there's a correlation between adrenal fatigue and stress, because obviously the adrenals produce adrenaline and stress hormones, don't they? So I'm just assuming that if your stress hormones are really high a lot of the time, that's going to have an impact. So again, how would you define adrenal fatigue? How would I know if I had adrenal fatigue?
So it's actually adrenal dysfunction because it's not functioning optimally. So again, yes, symptoms would be dizziness when you wake up, maybe urinating excessively, you would feel that your electrolytes are off balance, so you may be craving salty foods, you may be having this thirst, this, you know, I can't think of the words, there's something wrong with my brain. You're not able to satiate this thirst that you have, would be a sign of the adrenals not functioning optimally as well. It may be fatigued all the time. You might be finding that you've got a really low ebb of energy in the afternoon, or you might feel that even in the morning after a long sleep, you're unable to function optimally. And what happens is, yes, that surge of cortisol is necessary, as we need norepinephrine, we need epinephrine, we need all of the things to make us work. And on our adrenals, you know, that's also helping us to get adrenaline to go. It could also be a sign that if you go and do a heavy workout and you're exhausted afterwards because you're highly stressed, but that's what keeps you going. I'm highly stressed, but I'm going to go for a 10K run because that's what's going to do it for me. But then I'm knackered, and then I go and have coffee, which is busting the adrenal cortex again.
Or a glass of wine.
Well, you know, what happens is the constant surge of cortisol then exhausts everything else because it's constantly going. That can create an acidic effect because our body becomes inflamed. We need cortisol. Cortisol is a great steroid hormone. You know, when you get an injection, we've got cortisone injection to support the need for the inflammation. We've got cortisone, steroids, so on and so forth. But when we have that surging through our body too much, our body then is inflamed, it's stressed. We can have something called hypocortisolism. So there's hypocortisolism and hypercortisolism. So the hypo is there's too much, and then the hypo is actually my adrenals are just exhausted because there's nothing there. I've had so much of it that I've burnt my adrenals right now, burnout, and I need to rebalance. So it's about getting that balance back in, and it's lifestyle. It's not just about medication. You know, and most medications, pharmaceutical medications, are not going to support the adrenal cortex. It might be something like adaptogens are needed. There's a supplement called adrenal cortex, but it might even be that the DHEA in the body, the hormone, is dropped right down because there's been too much cortisol in the body. So it's a master organ. So the adrenals just, you know, it sits on top of the kidneys. And it's about how the medulla, which is the inside part of it, is functioning. You know, what's getting in on a cellular level, what's happening. So those would be the signals: salty, craving, exhausted, dizzy when standing, not sleeping, exhausted when waking up. All of those things can interconnect to that part of the adrenal cortex.
So, Alison, in your experience then, which diseases would you say are linked to stress and trauma? Which
There is no caveat on it. There isn't. It could be enhanced intestinal permeability, which in and of itself isn't necessarily a disease, but you've got enhanced intestinal permeability, leaky gut, you're starting to have a blood-brain barrier issue, which causes inflammation, autoimmune issues. So there's over 100 autoimmune illnesses. And those, chronic stress, yes. Lifestyle, yes. Trauma, yes. There isn't a specific diagnostic, you know, manual. I mean, there's the DSM 5, which you can look at for all kind of mental health issues, and there's 50,000 diagnosable illnesses and diseases in our current world that we know of. How many are linked to trauma? Who knows? But if we didn't have a traumatic experience, would we have that illness? A traumatic birth, even in utero, if a baby, unborn baby, experiences trauma. You've heard Gabor Mate talk about this when he was born, and he was born at that time. So war babies, we've got the Ukraine issues now. Those people are going to have experienced trauma before they've even known how to say their own name. So that in itself, so if you have trauma in utero and you start to develop illnesses, for example, then is that connected? Can we go back and heal that? Things like, say, sacrocranial therapy might help at that interim point. Then they might develop issues, gut issues, psoriasis, eczema. I've seen many people have all of these different things. So eczema and psoriasis, again, autoimmune issues that have been connected to a chronic illness or lifestyle or whatever, and a state of imbalance in the body. So you have allergies. You've got allergy sensitivities to foods, and you know, we have to be careful of who is what. And it's my main emphasis on all of it, Ali, is it's absolutely bio-individual. As you know, a traumatic experience for one person may not be for another. But that traumatic experience for that person may be emotionally challenging, and that emotional traumatic experience for the other person may just be a state of dis-ease in their body that they don't recognize for a decade, until it starts to come up and they see it, they feel it, they hear the whispers. The inner wisdom is giving them nudges like adrenal dysfunction. It's giving them nudges like a woman, irregular periods. it's given a woman nudges like endometriosis. It could be anything. So if I come back to your question, is what diseases or chronic illnesses are related to trauma? Anything and everything, depending on the individual itself. There is a book called The Dandelion and the Orchid. And, what can you survive? What environment can you survive in? How strong are you? Or how much more nurturing do you need? Sure. So it's very much bio-individual, and looking at what the timeline is and what the symptoms are, the lifestyle, and what is aggravating and enhancing something in their body, as opposed to, enhancing and healing their body.
Fascinating. So fascinating. The other question I wanted to ask you about was, this seems to be a lot of talk at the moment around cold water therapy as being really beneficial for, stress, trauma, etc. And it's all over social media at the moment. I know this is something that you are trained in. Is that correct? Or
I'm just starting. I'm just starting. So for me, I've had a real issue because of my thyroid, and I have got undiagnosed Raynaud's, where I get super cold. I can't move my hands and things. And I ski for a couple of weeks a year, and that's my idea of being cold. And it's enough. So when I actually went to a Wim Hof workshop last year, and I did the ice bath challenge, but I did the breath work and everything with it because I was fascinated and intrigued. And actually it is quite, I don't want to use the word addictive, but it is. But the reasons behind it, and it's not just Wim that's made it, this super thing. I mean, Wim Hof's been doing it for 20, 30 years. There's actually history, like anything. It's been there, but now it's the newfound thing, like you say, all over social media. But again, it's the hormesis. It takes your body into a stressor, so that's not in your head. So the trauma, the ruminating thoughts that's there, it takes it back into your body. So you're focusing your mind, you're getting into the cold therapy. It supports everything, your DNA, longevity, healing, pain. Everything that you could possibly think of has been linked to cold water therapy, and how it actually can help you to create more energy in your body, have better sleep, because you're going. So you talk about adrenal exhaustion and dysfunction, as we spoke about before, but you're not sleeping. So actually, cold therapy could put a mild stress on you for 2 minutes, 3 minutes, 4 minutes, however long you want to do it for, and can actually enhance your sleeping patterns, for example. So then you wake up, it can actually rebalance. So I work a lot with fasting with my clients, intermittent fasting, and the best way to do it is on an empty stomach as well. So therefore you're utilizing digestion, gut health, mind, body, spirit, soul, everything else. It's dealing with potential rheumatoid arthritis issues. It's just fascinating. And the research on it, I mean, Wim Hof's been in Stanford, he's been in Harvard, all of these scientists are doing the research on it from the benefits of it, but supporting chronic fatigue. So all by itself, it's helping you on a healing journey. It doesn't mean that that's all by itself what's going to happen, but it's part of it could be cold shower. It could be cold shower for 30 seconds for the first week, 45 seconds for the next week, a minute for the next week, and so on and so forth. So I'm still quite new at the process of it until I've qualified. But there's a huge waiting list for people to be certified Wim Hof coaches now.
Okay. So from a nervous system regulation perspective then, which is obviously really important in trauma work and stress work, as you know, it has a massive impact on the vagus nerve, right? Because the vagus nerve plays a key role in regulation.
It's everything. It's the vagus nerve, it's the central nervous system, it's your autonomic nervous system, it's all of the nervous systems, and just taking yourself into, like you said, that regulation of body, mind, and presence, of breathing in the here and now, to know that you're safe, to know that everything is all well in this moment. I'm in control of it. I get to choose to do this. That by itself is regulating for a human being who's been traumatized. So
just feeling safe and knowing that you are
safe.
safe. Yeah.
Yeah. I get to choose to do this therapy, and I get to feel the benefits of it. I get to feel that my body physiologically, chemically is beginning to heal, because this therapy, we tie breath work into the cold therapy, because again, nervous system regulation, that anxiety needs to calm down. That happens with breath and thought. So we can take ourselves into a more mindful place and a safe space. Then we get to do it. There is an issue if, you know, being in the cold water has been something that's been traumatic to you, then that's a different level again, and we'd have to work a lot of talk therapy before that, and really encouraging creating that safety and that safe space for them to feel safe and to feel that it's a healing process rather than a harmful process. But the healing benefits, as I say, for cold therapy, it's still undergoing. We still have Wim Hof being in all of these different kind of, you know, tubes and incubators and so on and so forth. But if you look at the community of cold water therapy, not just Wim Hof, then people are really reporting how it helps, because it alters your state of how you want to be. Well, I'm doing that. I want to eat healthfully. I'm doing that. I want to be able to exercise. I'm doing that. I want to have healing and, you know, nurturing relationships. We don't want to be doing one thing and then reliving that stress all the time. But the stress of the cold therapy stresses the body in a very healthy way so that we can calm it back down again.
Sure. So, Alison, we've spoken about lots of different sort of areas, adrenal fatigue and the nervous system, and we've spoken about, you know, the acid alkaline balance of the body. So there's so many different parts, right, when it comes to what you do, being a functional medicine practitioner. Huge. So what would you do then when let's say you have a new client? I would imagine it's going to be really important to take their bloods and to find out exactly what's going on, because just taking a history isn't going to be enough, right? So sometimes
not. Sometimes you can actually make really vast alterations by using your knowledge and listening to what they've gone through. And, you know, from functional medicine, we look at everything. We're looking at the gut, the kidneys, the liver, the pancreas, all of these systems we're looking at, sex hormones, so on and so forth. You can gauge what's going on without actually doing a blood test, but then we get the data. So, for example, if somebody is having issues of weight gain and they're not understanding why, because they're eating this, but they're not sleeping, they've had chronic stress, they've had a traumatic experience, well, then what's happening is the receptors for insulin are not working optimally. So we then have insulin resistance, which again, the blood sugar is too high, too much blood sugar. We can create too much acidity in the body because the body doesn't know what to do with it. So we can listen to that as a functional medicine and try and connect the dots. And then to really solidify, we have the data, which we would run a blood glucose test or a fasting insulin test. And normally general practitioners and primary care providers are usually very good to do something like a full RBC or WBC or a complete panel, which we get to look at nutrients. But a lot of the time, especially in the UK, resources are restricted, and the GPs don't really like somebody intercepting and asking for this, that, and the other. I'm very lucky that when my client comes to me, if they haven't got labs, I can write to their general practitioner or primary care provider, whatever it might be. And I said, these are the symptoms that the client has. This is your patient. Would it be possible to run these tests? And there might be a list of 10 or whatever. And we might be lucky and we get 25% of the requests. Sometimes we do get 100%. And then whatever we're not able to cover, then we can go and see what's going on. So a cortisol test, for example, in blood, isn't really very much use apart from the moment that it was taken, because that patient may have been absolutely stressed on the way to the hospital. They may be petrified of having a blood draw. They may have had an argument with their partner. They may not be afraid of the needles at all. Anything could have happened in that process, which raises the cortisol levels. And we've only got one sample.
Sure.
So if we detect that we might have adrenal dysfunction, other than Addison's disease and other things that go on, then we'd start to inquire of an endocrinologist to go a little bit deeper. But we would do a Dutch test. So a Dutch test, and I wrote it down because I always remember the acronym, or forget the acronym, should I say. So it's a dry urine test for comprehensive hormones. So that does things like cortisol, DHEA. We look at what's going on with progesterone and estrogen. So the 3 estrogens, we look at what's going on, pregnenolone. We look at all of those things, and it's called CAR. So it's a cortisol awakening response. So we look at what's happening when you first wake up in the morning. Is that person who might have adrenal dysfunction really flatline and goes lower and lower through the afternoon, so they've got no energy and there's no adrenaline coming up? Or is that person really high where we're meant to be spiked within the first 30 minutes of waking up, because that's when we get our energy? And is it a nice kind of flow that goes down, or is it an up and then a drop? So that's why we would do the dry urine test as well. And it also assesses how the body is metabolizing hormones. So for example, going a bit sciencey again, but if somebody has gained weight and they have insulin resistance and they have hormone issues going on, now adipose tissue loves to kind of draw in estrogens. But actually the estrogen prefers the adipose tissue. So what happens is it stores there. So lots of people who have trauma are just like, I'm just going to lose 10 pounds. I'm going to lose 10 pounds in 10 days. Happy days. Okay, we've lost the fat, the adipose, but the estrogen is now circulating somewhere else in the body. It's trying to find somewhere else to go. What does it do? So we still have an imbalance, and now we've got this free estrogen flying through the body, not really knowing what to do, causing other issues. So it also looks at progesterone. So you might be at the point where we can assess on the Dutch test, is that person in perimenopause? Is that person in menopause? Is that person nowhere near it, but actually they've got the adrenal dysfunction going on and they need support because these hormones can't produce properly. So they're so stressed that they want to have a baby and there's no progesterone there. And we need that in order to be able to carry a baby through the 9 months healthfully. So we look at that. The Dutch test is really great, and it assesses all that, which is great. We do an organic acids as well. We can do a heavy metals to see what's been going on. Is there mold? Which is great. We can do a hair analysis as well, mineral hair analysis. And those kind of things really help. And we'd also do, if there's real issues with the gut, for example, I mentioned at the very beginning, I'm not sure, no, actually, I think this is when we were offline. So SIBO, so small intestinal bacterial overgrowth. You have EMO, which is intestinal methane overgrowth. So it's a gas. And then you've got EFO, which is a fungus in the gut as well. I may have got those acronyms the wrong way around. But we can do a test for that. So it's a breath test. We can't test SIBO in stools because it's a small intestinal bacterial overgrowth. So it's not migrated down yet. That's why it's stuck. That's why it's there. So we can do a breath test for that. If there's constant diarrhea and so on and so forth, or just constipation, we could do a GI 360. So we assess the stools and see what's going on, what's happening with the microbiome, what is the imbalance, have we got overgrowths of anything bacterial wise. I'm not going to list them off, there's hundreds of bacteria, but strep A was a big thing that was on. So streptococcus and E. coli, they can be in the gut. And if there's an overgrowth of that, then that's causing an issue with the gut. It could be candida overgrowth. I mean, candida's all over the place, but if it's in the gut as well, that's an issue. So there's tons of stuff that can come up with a bacterial overgrowth, which is the microbiome imbalance, which will show enhanced intestinal permeability. So there's quite a few tests that we would do on functional testing. Again, a full thyroid panel, which is usually not available through the NHS, but if you have private insurance, especially if you're in the States, then a full thyroid panel may be able to show, because that thyroid is the master hormone, and it's again affected by chronic stress and trauma because it affects the hypothalamus and the pituitary gland, and then the thyroid and the liver and the adrenal cortex and everything else. So that little thyroid master hormone is responsible for quite a lot. So a lot of my clients end up doing a functional test for that, because we just can't get all the tests necessary on the NHS. So if that answered your question, then yes, we do tests. You know, and there is two adages of test, don't guess, but what can we pull out from the symptoms that are already there?
It's just fascinating to me, and there are just so many moving parts, and to me it makes so much sense that you would go to someone like yourself and have proper labs and have proper tests and all of that, because otherwise, you know, a lot of my clients as well will, we sometimes have a conversation about which supplements should I be taking, you know, and people will take supplements that they think they should be taking, which, you know, something like vitamin D3 is, we should all be taking that anyway, you know, that there's a nice guideline in place for that. But
it's a recommended guideline, and again, it's not an optimal guideline, because you can take too much, you can take too little, and the estimated guideline is way down where a human person is actually, again, bio-individually requires it, because are they absorbing it? Are they utilizing it? It's essential for gut health.
Yeah. But again, it's just about finding out what deficiencies do I actually have? What should I be taking, rather than me just going into Boots and saying, right, I'll take vitamin C because that's good, and I'll take vitamin D3, and I, you know, and that's what a lot of people do, right? So.
And it, you know, I try to make it as simple as possible, because D3 alone, you need vitamin K with it to be able to absorb it. You need a fat soluble vitamin to be able to have it, so it doesn't get stored in soft tissue as opposed to the bone. So you need magnesium with that as well, vitamin C. And it's when you take supplements, okay, I'll go down to the local store, but turn the label around and have a look at the efficacy. So has it got bulking agents in it? Has it got fillers in it? Has it got rice flour in it? What else has that supplement got in it? If you've got someone with constipation and you've got those agents in it, the efficacy is going to be far less. But again, top tip for anybody who has got these issues, if you have chronic diarrhea, then a bulking agent may be actually optimal for you, because it's going to take longer to transit.
Alison, I could talk to you about this topic for ages. I'm just conscious of the time, but it's been so fascinating. I have one more question for you, just before we close, and that is, could you give, we've obviously spoken in depth about quite a lot of health, you know, matters today, but could you give the viewers some practical tips that they could begin to implement that would help them from a functional medicine perspective? What would you say to someone, right? Because people are probably thinking, well, where do I start with all of this, right? I've had stress in my life, I've had trauma, like I have health issues, like where do I start? What would you say?
I'd say take a deep breath first to try and regulate, and start with a journal, because we survive, as I said earlier on, and sometimes what we live with and live through on a day-to-day basis, we forget. I have a headache, so I take paracetamol every day. You know, I have diarrhea, so I take whatever might be on the counter that's suggested for diarrhea. I have dry skin, so I lather this on or that on. So it's a case of take a journal and write down and assess what's going on for you. Think about emotional connections. Have you had a really traumatic day, so you need a glass of wine? Or have you had a stressful day that's triggered the trauma, that's created an emotion within you that you feel that you need to numb out with something else that distracts you? And how often does that happen? What do I eat when I feel bloated? What do I eat when I can't sleep? What have I eaten 2 days ago? And this is where people have a disconnect, is what have I eaten within the last 72 hours? And now I feel itchy, I feel bloated, I feel lethargic. Because a lot of time, for example, if you have thyroid, if you have hypothyroidism, and we talk about hypothyroid more so than hyper because it's more common, especially in women, having gluten and dairy all by itself can cause fatigue if you have those issues. If you're eating foods that are inflammatory for you as an individual, because one person's inflammatory food may not be for another, then what are the symptoms coming up? So my optimal suggestion would be journal, even for a week, and notice what the symptoms are. And then you start to become your own detective, that actually I had fish and chips on Tuesday, and on Thursday I was still having diarrhea, or I was still constipated, or I was still bloated, or I had a glass of wine on Sunday and I can't shake this headache that I've got today. Actually, have I got a response where I can't deal with sulfation? So the sulfate's in wine. So is it that I've got an issue with my gut that I can't get rid of those sulfates that are in it, the sulfated foods? What is it? What's optimal for one individual who is watching or listening right now may not be optimal for the other. And that's why I don't do a broad blanket approach. Every one of my clients is individual. You know, they're not the same. They don't have the same markings. We don't have the same fingerprints. We don't have the same DNA. We might have the same DNA parents, but we don't have the same DNA effectively, because we alter our DNA and we alter everything. So keeping a journal, as laborious as it may seem, will give you that detective work for yourself to notice what happens. Even if it's, my child really irritated me and I got super stressed, so my stress signaled an alternative response. Why didn't I sleep? Do I have insomnia, or do I have sleep apnea?
Sure.
So
that is such great advice. That is such brilliant advice.
It's broad blanket, but again, it has to be that individual takes a stance of becoming your own best detective.
100%, and taking responsibility for your own health, right? At the end of the day, whether it's spiritual, emotional, physical, everything, you can't separate anything out, right?
And the thing is, if we don't have a connection to any spirit, faith, belief, then we're going to be struggling anyway. What is the belief system? Are you just in that do, go, 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 which we spoke about before, the things? Or are we connected to something, whether it be God, higher power, the universe? What is it that we believe in for ourselves? Can we believe in the good? That brings me on to that journal as well, the gratitude part of it. And in a trauma response, it's very hard to feel grateful for anything. What have I got to be grateful for?
Yeah, 100%. I mean, when I do EMDR with a client, as you know, EMDR, it's not just the processing, but it's about that cognitive interweave where you change that belief, which is, you know, what's wrong with me? I've had such a horrible life. Why does everything happen to me? That narrative, that, as you say, that belief that needs to be switched as well.
Well, it's becoming aware of the unconscious. It's consciously becoming aware of the conscious. The same with eating behaviors, and emotional eating is part of, you know, a trauma response as well. But it's when we can, I can do a whole nother conversation about this as well. But it's like, you know, if that chronic stressful day has either had you with a glass of wine, or with your head in the fridge with your mouth full of food before you've even taken what you want out of the fridge and put it on the side, is that a sabotaging behavior, or is it a self-soothing behavior that you've become so used to, but now your body has kept the score and now it's coming back to say, actually, this isn't working for me. And again, it's a moving part. You said moving parts. Healing is moving parts, because what worked for you a month ago, a year ago, 10 years ago will not work for you now as you've evolved.
Absolutely. We're changing all the time, right?
Yeah, on a cellular level, on a microbiome level, everything changes. So it's being adaptable. And I think that is, it's enabling those adaptations as you need it. Because we adapt every day. If you've done ice therapy, cold therapy, whatever, and you've been for a 10-mile run today, the adaptation is going to be, your body is going to need more nourishment and nurturing than it did yesterday when you just did the cold shower and didn't run or exercise.
Sure. Yeah.
So the patterns are there, the timeline is there, the journaling and understanding your body so that you can create self-mastery is super powerful.
I think we're going to have another discussion, right? Because as you said, like emotional eating is just that in itself is a conversation on its own, right? So it has been so amazing talking to you today. It's been so interesting. Thank you so much. Last question, where can people find you?
So I have a website coming soon. We're working on it. It's nearly finished. It's just www.alisonstockton.com. That's going to be out soon. And then I'm on Instagram, which is _enriched woman.
Fantastic. Thank you so much, Alison. And I'm sure we'll talk again soon.